Evening. Today's conversation is not about what's going on in the news. It's about something that you and I should spend some time thinking about. Today, we're talking about congenital heart defects. This is basically a problem in the heart that babies are born with. In many cases, people go through a large portion of their lives completely undetected. And if not detected on time and if not treated on time, it could lead to serious problems, including death. Today, we're going to talk about why it's important to stop and understand what CHD or congenital heart defects is. For those who are having babies or expecting babies soon, why screening is important, what we can achieve with that screening, and for the rest of us, what we can do to help more and more babies across India, at least, find the treatment that they need. So, I ask for your indulgence if you're watching at home to give us some time to have this conversation because it's something that's important. So I want to introduce my guest for this evening. Joining me right now is, to begin with, Priyal Guliani. She is a lifetime volunteer at the Oura Project. She's also a former business journalist. Dr. Mitosh Ruparel is a consultant radiologist at Harmony Clinic. Dr. Rachana Shetty is a consultant pediatrician and neonatologist at the Purnima Hospital, who joins us as well. Good evening, all of you, and thank you for joining us. I encourage our audience to ask questions in the chat window through the conversation, and we'll try and answer as many of your questions as possible. I do want to start by offering Priyal the floor so she can share her story, because it's from her story that this entire conversation stems. So, Priyal, for those watching at home, please share your story and why you believe it's important for us to have this conversation today.
Thank you. Thank you so much, Faye. It means a lot for you to give this platform because there is one mission that I have right now in life is to about share about congenital heart defects. Uh, and of course, it stems from a personal story, as you are aware, and I would share with the audience as well. I am a mother of a congenital heart defect baby who could not live beyond 4 months. In my case, despite probably thinking that we know a lot about world, we had privileged backgrounds in terms of learning, education, and everything. My entire detection went unnoticed, despite the fact that I was 35 years of age. And one basic thing that is required, which is a lot of a standard thing, mostly in other parts of the world, as I learned later on in life, of course, is that the fetal echogram is something that is made mandatory or is a part of the procedure when you are conceiving at 35 plus. Doesn't mean that it doesn't happen in cases where it's I mean, for women younger that age or later that age or whatever. But in my case, it was to be done. It wasn't done because I think all my other parameters were coming fine, and my doctors decided not to sort of prescribe. And not that I was that mother who wanted to do every test at that time. I just looked at it as if like, oh, this is a new phase of life. I have to leave it. I have to lead it or go towards it as normally, naturally. I was working, everything, and leading a very, very healthy life when I had conceived my firstborn. And the other reason to tell you is that when my daughter was born, we were very lucky to know that very day, despite being in a nursing home, that she has a very serious issue. The reason I'm making these points, Faye, is that these are all the conversations that the doctors, when they will hear me, and the others who will understand, and those who are going through this whole or want to learn about it, these are the important things to know. So I did not know I had a child who had a CHD. So when she was born, mostly kids do not, as you mentioned earlier, things go unnoticed when you're in a nursing home setup and so on and so forth. My daughter, when she was born in 2016, her saturation level did not go beyond 87%. Now we all know about saturation level thanks to COVID, but that time that was something, it's like, okay, saturation level is 87, so, or whatever. So it didn't go. I was not made aware of her condition for 2 days. And my husband had to take my 0 day old baby to a bigger hospital to know what is happening. Um, she was diagnosed with a very rare heart condition called, anyways, it was a very, very rare heart condition. And one step led to the other. And we were 4 months in the hospital after coming back home, and then we had to take up for the surgery. We were 4 months in the hospital. There were improvements, there were things happening, there were a lot of layers to it. But that journey was such a telling journey, because there I saw so many parents struggling to get their children operated because of the lack of funds. There is, the awareness about. I mean, I had zero clue. I was in the, I was supposed to be knowing things in that sense. You're news, you would know anything. And I have a very story that you would understand, Faye, that when my husband came to that hospital room, I was still in my nursing room, to tell me or disclose that we are in a situation when our child, our firstborn, has a very rare heart condition. The only thing that came to my mind, and I think you will remember that one of the first stories that I did on insurance was child insurance. And at that time, there was an exclusion that came out. And that time, the child insurances had come out. The exclusion was anybody with a congenital heart defect. And all I
Right.
could think at that time was that my child is not going to have insurance. I mean, I know it was just something that came to my mind at that time. And of course, the reality was far more difficult and far more. Um, uh, I saw so many families going through that problem of not having money, and so my husband and I decided very early on, when we were in a hospital. We had just gotten, and there was this little family that was trying to support us. That this doctor that you've come to is great doctor. You'll be Everything will be fine. And so we became very close families, because all families would be living together. 2 months, 3 months in the hospital with together. And when we were getting discharged, despite my daughter needing four more surgeries, after she gets a little bit of weight and things like that, that family that supported us came to us and said, "My child needs one last surgery to survive, and we have nothing. We've sold everything." And my husband and I, despite just 4 months after 3 months in the hospital coming back, we tried to raise funds. We were lucky enough, and by God's grace, that kid is doing relatively fine. He's fine. He's alive. He's surviving. He's thriving. But obviously, there will be little bit issues, being a heart defect, concern. The last message that I received for him many years back, and I'm talking about this 8 years back, but 2, 3 years back, she said he wanted me to remove his name, because he doesn't want the world to know he's a PhD. So I said I'll try my best to remove it from the site we raised. But the amount, I mean, there is hope for people to get treatment, but the problem is it is very expensive. And that is why my husband and I dedicated, on the first birthday of our daughter, that we have to work towards it. No, no question asked.
Thank you, Priyal, for very briefly sharing that story that you went through. That would not be easy to relive every time you tell that story. But it brings us to this important conversation of screening, of awareness, of talking about it, of raising funds for children who can't afford the treatment that they need. Dr. Ruparel, thank you so much for joining us. It's a pleasure to see
Thank you.
you again. We've had many of these conversations, you and I, about why it's important to do the screening and how we have the technology. Nearly everything, not everything, but nearly everything. Uh, Tell us about what kind of screening is available and why parents, prospective parents, should insist on it.
Yes, thank you for inviting me, Faye. And I would like to share whatever I do in my routine practice and what people should do. So, we have really good technology now to detect most of these problems, but the patients have to be very particular about going through these screening procedures. So, first of all, when they start off, the dating has to be accurate so that they do their following scans at the time when it is to be done. So, once this starts off and the pregnancy is confirmed, the most important scan happens at around 12 to 13 weeks. At 12 to 13 weeks, we call this as the first trimester screening, where there is an important ultrasound examination and there is a blood test called biochemical screening. Now, this evaluates one for chromosomal abnormalities. Also, we look at the heart at that early stage and we get an idea whether there is four chambers present and the outflow tracts are good enough or not. On transvaginal scan at that point in time, we get a fairly good view of the heart, and at that time itself, if there is a gross cardiac abnormality, we may be able to red flag that patient, and we may call this patient for more dedicated screening and keep a watch on such a patient. The next scan we made for such suspicious patients, we might want to scan them early at about 16 to 18 weeks, but ideally 18 to 23 weeks is the best time to look at the complete structural details of the heart. And we get very good views of all the four chambers and all the connections of the heart at that stage. So these things should not be skipped. Now, what happens is people, there is a low risk group and there is a high risk group. So patients who already have a mother, father, or sibling with a heart defect, or a patient with diabetes, or some infections, or on some drugs, these are patients with who are in the high risk group, and these people are subjected to cardiac scans. And the so-called the low risk groups are not subjected to the evaluation of the fetal heart, which is very, very necessary, because 80% of the fetuses detected with congenital heart defects, they come from the low risk group, because that itself is a large group who is not subjected. So it should be a universal screening for everyone to do a dedicated fetal echo at the right time.
Dr. Shetty is with us as well. She's a pediatrician and a neonatologist. I hope I said that right. Dr. Shetty, what can be achieved if we scan on time and we detect on time?
First of all, thank you for having me here. My condolences to Priyal. I can empathize with you, and I hope such scenarios are not repeated in our country. Now, I'd just like to give a little background about why heart defects happen in the very first instance. See, around the 18th day of pregnancy, of gestation, two heart tubes form in the embryo, right? And they go on differentiating, and a full-fledged heart pumping blood is seen by 10 weeks. All right. Now, this happens within the first 2.5 months of gestation. So before the lady realizes she's pregnant, her heart, rather the baby's heart, has already formed. And during this important time, if there is any insult, it will result in defects in the baby's heart. Insults like what Dr. Ruparel said, if the mother is having a systemic illness like diabetes or autoimmune illnesses like lupus, or if she was unfortunate to catch a rubella infection during her pregnancy, or if there were any chromosomal anomalies or defects in the genes, which would be caught up in the blood tests in the first trimester. Also, if she's on drugs, psychiatric drugs, drugs for hypertension, for acne even, and if there is a history of congenital heart disease in the family, and in Priyal's case, she was an elderly primate. So these are all high risk factors. So you have to keep a high index of suspicion while doing the scan. So each scan, we do a scan in each trimester of pregnancy, that is every 3 months of pregnancy. During each scan, you have to look meticulously at the heart. All right, you do a screening, but you go into the scan thinking there's something abnormal, and then you go on ticking all the boxes to reassure yourself that everything is normal. So look at the four chambers of the heart, look at the outflow tracts, and Dr. Ruparel will tell you more, even the 6 planes, the sonologists, everything, they look at the 6 planes. So you're well within your rights as a parent, and if you're anxious, to ask the radiologist or the obstetrician doing the scan, are the 4 chambers all right? Is the outflow tract all right? And are all 6 planes okay in my baby's heart? Okay, and every scan, whether it's the first trimester, second trimester, or even the third trimester scan, you need to look at the heart very, very carefully. There's so many heart diseases picked up even in the last scan, just before delivery. things like coarctation of aorta or aortic stenosis, that is narrowing of the aorta, is picked up just before birth. So at least we will be in preparedness for the babies when they are delivered, when we detect such conditions. So this may have been missed in an earlier scan, or it may be an evolving heart disease. Nobody it may be an evolving heart disease. And so every scan is important. It's not that, the 18th or 23rd week scan, which is called the anomaly scan, that is the most important scan for looking at the heart. No, not so. Every scan is very important, and ample attention should be paid to the heart. Having said that, another thing that I would like to bring to the forefront is there is an amendment of the Medical Termination of Pregnancy Act. We had a Medical Termination of Pregnancy Act brought in 1971, wherein you can terminate pregnancies up to 20 weeks. But now the recent amendment in 2020 allows you to terminate pregnancies even beyond 20 weeks. It's like approaching a court of law. All right, you can just go with your valid medical documents. It'll be reviewed by some pediatricians, some radiologists, 2 registered medical practitioners. They will all review the case, and if your case has merit, you can even terminate the pregnancy if the baby is found to have a severe congenital heart disease, like say a hypoplastic left heart syndrome or Epstein's anomaly. And mortality. More than mortality, it's the severe morbidity. I mean, there will be no quality of life, both for the child as well as the caregiver. So this is something that I wanted to highlight. Parents have this option of approaching the medical board of review. You can go to them. It is there in every state. It is there in government medical colleges for termination of pregnancy beyond 20 weeks
Right.
also. Yes.
I see Priyal wants to come in. Go ahead, Priyal.
Yeah, as you mentioned, I know I don't know. I mean, I'm not a doctor to have an expert idea about that, but in my case, it was truncus arteriosus. So I don't know whether the chambers, etc., but the fact that it got missed in my scans, and fetal ecography definitely did not happen that I'm aware of. But in fact, it missed the scan. That was one important thing that happened in my case. The second, which I think both of you can sort of point out, that had I known, I mean, at 21 weeks, I would have decided. I mean, I remember when I had my second child, and that was in the United States. I was very, very clear that I'm not sure if I can carry on if my child has another anomaly, right? And I really had to, Faye, at that time, struggle to think that how will I manage it in US, because I don't have those rights which Dr. Shetty is just talking about. But coming back to India, one, I think, I know after I've gone through, I've heard very often that those procedures have to be there, where the fetal ecography has to be done. All those factors have to be taken into consideration, especially if I was 35. But I was in Delhi. It wasn't that I was in a tier 2, tier 3 city that it just went unnoticed. But sometimes I guess I was destined to go through that phase of life to see a child come in, and probably that's why I say my daughter has come with a purpose, that I have to work towards children who are born with CHD, and sort of providing the financial support, whatever, in a limited capacity or whatever capacity that I can. But my question to you doctors is that as a young mother, you're at 22 weeks. It's a substantial time, and then you say you get to know the information that your child has some issue in the heart. At that time, as a mother, I would know whether she or he, the child, has something like a truncus arteriosus, where she has to have a surgery at every growth stage of life, and so therefore I should think of termination. Or there are, because it's a huge scope of CHD cases. It could be just hole in a heart, which I learned much later now, that sometimes it just goes away on its own in some cases, a caveat there, but it is the simplest of the heart issue that a child can have. So how do you sort of consult your patients? And it's 21 weeks, you're already sort of attached to me.
Priyal, you're saying at what point as parents will we know the severity of the heart defect, so that we can make Because
That
also
is
when we're talking about a pregnancy, every passing week is a different stage, right? So it doesn't
exactly.
give you too much time to make these decisions. I'll take the question first to Dr. Ruparel. I have two questions actually for you, Doc. One is, why is it not mandated that all prenatal women receive these scans? Because if this was what 7 8 years ago in Delhi, if Priyal did not receive the scan, it means it's not mandated. And we have some pretty tight rules about the kind of screening that we do for children and for babies. And secondly, is it also possible to tell the severity of the defect when it is detected?
So there is nothing like mandated or not, but now in the last 7 8 years, the concepts have changed, and the way people are scanning the fetuses is totally different. So it is not that we do the fetal echo only if a specific fetal echo has been asked for. So almost everywhere and everybody does the complete scanning, including a detailed fetal echo. The equipment has also become very, very high resolution. And now we do fetal echo even at 19 weeks, even at 23 weeks. And as Priyal rightly said, at every scan, we do see all the structures. It is not that we just do a growth, but yes, from after 23 weeks onwards, it is mainly a growth scan because most of the abnormalities can be detected by about 23 weeks. So, yes, there is nothing mandatory of which scan has to be done well, but now the protocols are well laid and we all follow the guidelines, and everybody has the skills to do a good fetal echo, not only a basic fetal echo, but an extended study where most of the abnormalities are detected, and very few like VSD or a small ASD and all can be missed.
Doctor,
Technically, ultrasound is very, very demanding. It's not as simple. Because it all depends on the body mass index of the mother herself and the position of the fetus. So one has to be extremely patient and not let any fetus go till everything has been seen and documented.
Dr. Shetty, at what point can we tell the severity of the defect and whether or not, what steps we want to take going forward? You're on mute. You'll have to unmute. Sorry.
Can you hear me?
Yes, yes.
Yeah. There are so many. As I said, it keeps evolving over a period of time. Something like septal heart defects, ventricular septal heart defects, it actually, most of them, 90% of them close by itself. So we wouldn't raise red flags there. But something like that, where some of the conditions I enumerated earlier, hypoplastic left heart syndrome, or a total anomalous pulmonary vascular circulation, or transposition of great arteries, where the aorta and the pulmonary artery are switched. Well, these are really, bad conditions. As I said, they have high morbidity. Mortality is still all right, I feel. Morbidity, both for the child as well as the caretaker, it is immense. So these are conditions where, you would counsel the parent that probably it is not worthwhile going forward. But ultimately, the decision lies with the parent, whether they want to continue the pregnancy or not. We can just be counselors. We can tell them, how severe it is going to be. Whether they want to continue with the pregnancy or not is entirely their call. Having said that, just a corollary to what Dr. Ruparel said, see, even if you pick up anything on the scan which looks abnormal, maybe around the 18th or the 20th week, sometimes the obstetrician is doing a scan and she sees only 3 chambers of the heart. I have seen this trend of, let's see, we'll wait for another month and we'll see later on whether we can see it more clearly because of all the problems that Dr. Ruparel enumerated. It's not very easy picking up things on a scan. Depends on the mother's body mass and even on the position of the fetus. So keeping all that in mind, they say, let's wait, we'll see after a month. Well, I do not advocate that. If there is something which looks abnormal, I would say that please treat it as abnormal and enlist the help of a pediatric cardiologist, like Priyal should have done. She should have gone immediately to a pediatric cardiologist, started with the scan and the review there, the monitoring throughout pregnancy, and gotten a multidisciplinary team ready for delivery. By that, I mean, you should have chosen a proper center. A cardiac center is optimal because they will give you the best outcomes for such a baby. Short of that, you could have gone to a level 3 NICU with a good neonatologist, of course, but where there is also a pediatric cardiologist on board. So, don't waste precious time sitting and doing nothing during pregnancy. For the 4 weeks or 6 weeks that you say we'll do the scan later, I think you should start cracking, get the required help, start monitoring, and choose your center instead of running after delivery from pillar to post like what Priyal was doing.
To be fair, Dr. Shetty, a lot of that will depend on adequate advice during the pregnancy, because as lay people, who are not medical professionals, we don't know what we're looking at on the scan. We have to be adequately advised, saying this is what we're looking at, this is what we've detected, this is what you should ideally go ahead and do. I saw Dr. Ruparel also, she said, I'm going to come back to you, but Priyal, do you want to say something?
Yeah, I just want to say, like, in my case, I had all my scans were like great. My gynecologist did not raise a flag even once for me to even consider going to I mean, the fact that my child had a CHD came as a shock 2 days later after I delivered. It was a shock to our whole system. We had no clue. I mean, I would have gone to a car. That's what I absolutely understand what Dr. Shetty is saying, that once it is detected, then the whole team gets ready and you do. Like in my case, I wouldn't have gone to a nursing home. I would have definitely gone to a place where there is something to take care. Had I known firstly that it's not truncus arteriosus and those decisions, etc. But if I had just known there's a CHD issue, then the situation would have changed or whatever completely in that case. But yeah, I mean, you wanted to ask something to Dr. Ruparel.
May I come in?
Dr. Ruparel?
So yes, I got Priyal's situation is that the abnormality was not detected at all. So that is why she could not prepare for anything. But such abnormalities actually can be detected if a scan is done in a proper place. And as I told you now, the skill levels everywhere in the country have enhanced so much, and everybody is doing a really good job. And even the equipment supports us, very high-end equipment available all over the country. But it was unfortunate. 2016 was not very, very long back, and at that time also, I admit that it could have been detected. And truncus is not a very minor abnormality to have skipped somebody's attention. Because instead of two vessels, like we always do the 4 chambers and the outflow tracts. So that is a basic scan. So instead of the two vessels crisscrossing, you have only a single vessel. That could have been much obvious at that stage, even at 20 weeks or 23 weeks.
I mean, for me, a personal story, I had my baby at 40, which is much, much later. And it was Dr. Ruparel who did all of my scans. And he was very thorough in the sense that he explained to me every single thing we were looking at. And I kept thinking of Priyal, thinking, why didn't she have this scan? If it's so, if I have access to this, why didn't she have access to this? And I can't tell you how much time I spent at that point thinking about what she had gone through. And, it wasn't, like you said, it wasn't that long ago. And why we didn't have that facility then, it broke my heart every single time. We have some comments. Yes, yeah. Go ahead.
Yes, it should have been picked up, and Priyal was unfortunate. But according to statistics, about 25 to 75% of congenital heart diseases are picked up antenatally, which means a significant minority remains undetected. Should have been detected, but still it remains undetected for whatever reasons. All are not of the same expertise. It's not negligence. It's just that scanning is difficult. All right. And having said that, about 25% of the babies are first detected when they are born. Now, a simple test that you can do before sending the baby out of the nursery is to do a pulse oximetry. As Priyal said, everyone is so conversant with pulse oximetry these days post-COVID. Just see the saturation of the upper limbs and the lower limbs. If it is above 95%, it's all right. There's nothing to worry about. If, as in Priyal's case, it was 87, then yes, there is a red flag. there is something to look deeper into. So a simple test. Of course, if you can hear a murmur, the mother comes saying that the baby's not feeding well, sucking and stopping, or there's a lot of forehead sweating. These are all, again, red flags for us. But short of these clinical signs and symptoms, just doing the simple test of pulse oximetry of the upper and lower limbs before sending the baby home will help us pick up so many more cases.
I just want to read out a couple of the comments that have come in. Fayes has said, I live with a spouse who has CDH, currently on pacemaker support due to arrhythmia for the past 20 plus years with 2 healthy kids. We've had our share of challenges, but we're living a normal life. And that's nice to hear. Akash Bagga says, thanks for doing this, Faye and Priyal. But there are incompetent doctors who are the bane of our country. My mother's cancer was misdiagnosed and we had to suffer for months. So would appreciate if the experts could share how we can find competent doctors in general. What are the markers or the characteristics of a good doctor? I know that this is a question across the board, right? It's not about pregnancy or otherwise. Everybody wants to know, how can I tell if I have a good doctor who's actually putting, real effort and real love into the work that they're doing? Dr. Mitosh, you first.
Yeah, so every doctor, I'm not siding doctors, but every doctor is in this profession because they want to do good for their patient. So if I do a procedure, I always want that procedure to be successful. There is no reason why I don't want any procedure not to be successful. But just like any other activity that goes on in this world, in all our lives, we cannot, in medicine, though it is expected that nobody wants to be on the other side of the statistics where their procedure was unsuccessful, but it is going to be there. So I believe that in our profession, everybody tries to do good work. Whoever scanned you also does not want to miss that abnormality. But whether it is me or anybody else with how much ever expertise, we just cannot assure that all abnormalities can be picked up. Because in medicine, it is as simple as that 2 plus 2 is not 4. In professions where actually 2 plus 2 is 4, in those professions also things can go terribly wrong, and that is accepted. But in somehow in medical practice, we all are extremely responsible, and of course black sheep are there in every profession, and one has to have their due diligence before they go to a person. But most of the people in our profession, they try to do good work, and they are just not happy if the results are not good.
Priya?
Faye, we've had pretty hectic work life. We've been, as a profession, we've lived a very, very hectic life. But I have another level of respect and thing for doctors. After I lived in a hospital, I saw their lives so closely because I was like literally living in a hospital. So I have an utmost respect for them. I did have a situation when, I was literally with my child and I was running from one hospital to another. There were doctors who were not, I would say, very mildly not kind, or, they were, in fact, there's one leading doctor, very renowned in the country, who literally told me to get out of the room, thinking I will not understand that my child has a serious problem, almost like sort of wanting that she doesn't even get a chance to get her first surgery. So I've had that experience as well. Very, very unfortunate of, this entire, one doctor will say, I believe in this. The other doctor will say, no, I don't believe in this. So, all that madness, and you don't know because you're not an expert in all of those things. But having said that, I think we have this is a very, very, very tough profession. They put in a lot of work and a lot of hard work, and I have an absolute respect for all the doctors, etc. Yes, I was unfortunate that the detection did not happen for whatever reason. As I said, I think I was destined in some way to experience this despite everything. And I think it's just how much you would want to trust your doctors. I've always trusted my doctors, and probably in one case trusting too much did not help, in the other case trusting too much helped. So I guess it's just something that we have to hope. I mean, that doesn't mean that any profession or any individual is doing, is questionable or not doing well. I think doctors put in a lot of hard work and effort in that. So, yeah.
Dr. Shetty, how do we know which doctor to?
No, the thing is about what Priyal said. Yes, I too believe in destiny. If it's bound to happen, I guess it will happen. I had my own niece, my brother's daughter, born with a tracheoesophageal fistula. On the first day of life, she was operated. And this, we had gone to the most reputed sonologist in our city who had the best resolution, ultrasound scanning equipment with him, imported from Japan, I was told, which could detect even a cut in the eyebrow. A cut in the eyebrow could be picked up by such a machine, we were told. And yet, the tracheoesophageal fistula, which means there's no connection between the baby's mouth, rather the food pipe, and the baby's stomach. So this was missed, and we had to rush her on the first day of life, get her operated, and thereafter multiple dilations. We've lived with that. And now, thanks to God, she's leading a healthy life. All right. So no point in blaming doctors. As Dr. Ruparel said, everyone tries their best, but then it is a tough job. It's those grainy images. If you try to see an ultrasound image, there's very little you could make out from what is happening inside. Plus, you need the baby to be in the perfect position to view everything correctly. The mother's fat mass also interferes with the proper visualization. All of this. So I don't think we need to crucify doctors or say the doctors were negligent or too commercial and they weren't really putting in the time or effort. Sometimes it's just human error, which we have to accept, and maybe destiny, as Priyal said.
Can I just come in?
Yes, go ahead, please.
So, regarding tracheoesophageal fistula, Rachana, that we can see a cut on the eyebrow is a little stretching it a little too much, but yes, we can see the eyebrows and eyelashes also. And but tracheoesophageal fistula, as you know, it is of various types. So all the types of tracheoesophageal fistulas cannot be made out. If there is a communication between the esophagus and the trachea, but there is still fluid going into the stomach, we may not. If it is a blind pouch, we will be able to make out. We don't see the stomach, we will be able to make out. It depends on the type of fistula. So as I said, it is in medicine 2 plus 2 is not 4. So a patient may say that tracheoesophageal fistula missed, but then there was no sign that can be picked up on ultrasound to pick that up. So in a tracheoesophageal fistula, we may have absent stomach bubble or we may see a fluid pouch in the neck of the fetus. If these things are not there and the fistula is of another type, then we may not be able to see that.
Yeah. This is what I meant by,
Yeah,
problems
right.
in picking up.
Yes.
Yes.
Yeah.
But finally, I want to ask Priyal again to share with us details of her project, which I understand has already helped tens of children across India receive life-saving surgeries that they wouldn't otherwise have had access to. So for those watching at home who are wondering how they can help, this is how you can help. Priya, go ahead.
Thank you, Faye, once again. And as I said, one is, of course, about detection, but the most important part is that once you are dealing with, because it's a fact that a lot of kids, the estimate, I mean, I can go with numbers and all of that, but over 200,000 children in India have CHD from of different range, and there are almost about estimates say about 40,000, and these are old estimates, and not even we don't have the updated versions as yet, but 40,000 we need serious surgery. Ara's case was rare, but there are many children whose lives can almost lead a near normal life after CHD, as you heard in the message that came in the statement in this very interview as well. So what we are trying to do is support the financial cost. I understand, and I'm not by any way comparing it. Please do not misunderstand me. But congenital heart defects is still something that people have a very limited knowledge of, very limited idea that there are so many children who need the support, and if they get the surgery and the medical assistance, they're able to survive. Through our project, which was born on the first birthday of my daughter, we wanted her name and legacy to continue. So we, along with Genesis Foundation, who pioneered supporting CHD kids in India, started this project. where we raise funds and we support kids with congenital heart defects all across India. We have supported, as part of the Aura project, over 70 kids so far in 7 years that we've been here. And this journey will continue because my daughter will live on. I will not let my daughter go by any means. So my daughter will live through those 74 hearts and counting, um, and with all the hearts that are thriving because of her.
So, for members of our audience who are looking for details on the Oura Project, you can find it on the Genesis Foundation website. You could just look for the Oura Project on Google. You can make donations. You can read more about it. You can get in touch with them to find out how that money is being used. So you can also be part of saving little children who need help and who need medical attention. Priyal Guliani, thank you so much for sharing your story. Thank you so much for the work that you're doing. Doctors Ruparel and Shetty, thank you for your time as well. For our audience watching at home,
Thank you.
let's stay involved and stay informed. Thanks
Thank
for
you.
watching.
Thank you. Thank you so much.
Appreciate your work, Priyal.
Thank,
Keep
thank you.
going.
Thank you.
Yeah, onwards and upwards, Priyal.